Doctors of Reddit, what are the dead giveaway signs that someone is faking? I'm a nurse on a floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone we were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her it had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them, because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain. Stat X-ray showed only gas. She just really needed to fart, but she was screaming, claiming it was a 10, and making a huge freaking scene. She demanded Dilaudid through her IV, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid, because she was already on so many opiates. She then demanded lorazepam, still through her IV of course. Doc was like, fine, whatever, just one time and only a low-end dose. I was flushing her IV with normal saline first, to make sure her IV was patent, and she leans back and is like, oh, that's so much better already. Hadn't even given her the lorazepam yet. SMDH, for real though, gas pain is no joke. I was once rushed to the hospital, as I knew I couldn't afford an ambulance, because I was doubled over in pain crying. I thought that something had ruptured or exploded. They weren't busy at all this night and got me back within 15 minutes of showing up. I don't like pills. Never have. Because I know I had an addictive nature when it comes to substances, so I just avoid them altogether. So they do their test and scans, and the doc comes in and tells me it's just severe gas buildup. I'm in tears still and ask the doc how the hell can gas cause this much pain and that it's gotta be something else. Doc says let me give you something, and if that doesn't work we can try something else. I'm like, okay, cool. Because no way gas hurts this much. 30 minutes later I'm in the bathroom like I just spent an hour at Taco Bell. The doc comes in to check on me when I finally manage a free moment. I can't help but look dumbfounded. Since they weren't busy at all, he sat down and explained that since I have IBS I need to be more careful with my intake or else this could happen again. All the while I felt like a complete dumbass, because gas had me in tears. I thanked the doc. He gave me some gas relief pills and suggested some diarrhea meds in case it happens again. I've never in my life been so sure it wasn't something only to be proven wrong. One time I was in hospital with decompression sickness and neurological damage and I couldn't piss. I told the nurse I needed a catheter, which she did right away, and I filled 3-liter bags straight off. Anyway, she commented that if a man actually says he needs a long tube pushed up the hole in his peanuts, then you can be sure he needs it done. As a nurse, I have never received more gratitude from patients than when I catheterize and 2-3 liters comes out. This makes me think about that people once died because they couldn't take a piss. Whenever the symptoms aren't there when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. Why would anyone fake any of this stuff, but especially a stroke? What is the point? Dude, she didn't have to wipe her butt anymore. Totally worth it. Born to it. No longer forced to wipe. That's a quote for the bathroom walls. I'm gonna put that up, thank you. My favorite thing about this thread is that half of the "here's how you know they're faking" comments get responses that are all, yeah, about that. Let me tell you how that assumption freaked me over and I almost died. Happens all the time. I have the reverse. My back went out, extreme sciatica pain, like being struck by lightning constantly. Couldn't move 4 days. When someone found me 3 days later they called 911. Just for the doctor to tell me I was faking it for pain meds. While I was crying in pain I asked him why I'd lay in a pile of my own piss and it for 3 days for some Vicodin when I literally own a bar. Freaking insane. Yeah. I got the same. Hurt my back lifting way too much. Went to a doctor when I started to have leg pain a few days later. Told him my leg hurt, but I was pretty sure I'd injured my back, and that I didn't want opiates. He proceeded to diagnose a soft tissue injury in my leg. It took about 15 months from that point on to get an MRI, which showed 3 ruptured discs, and an almost immediately scheduled surgery, laminectomy, discectomy, and foraminotomy. It's been about 15 years now. I wake up with back pain most days now, but it gets better as the day goes on, and seems to be improved with physical labor. Apparently a lot of people fake back pain for drugs, or doctors think people fake back pain for drugs. If someone is truly unconscious, their thumb always wiggle. Just say that out loud to yourself. Moms, I always know when you're lying, because your ears turn red when you lie. Kids, cover their ears when they lie. I told my daughter that she gets a red spot on her forehead when she lies. So, she started using her hand to cover her forehead when she lied. It's like how you can make anyone blush by claiming that they're blushing. The more they deny it, the harder they'll blush. I've had people ask why I'm blushing before when I wasn't. I never know what to tell them. That's just my freaked up face. Like, what do you want from me? Not a doctor, but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. That's genius. I have had a few seizures, and the injuries I've had from falling and thrashing are pretty legit. It would take a hell of a lot of dedication to fake those. That's the thing, though. People often don't fake them well. Someone I knew in nursing school had the experience of a patient who didn't realize they could be seen carefully getting out of bed, climbing over the bed railing to keep her from falling, laying down the floor, and then rolling around while screaming. My wife is a doctor, and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, "Now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison." While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove the right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then, but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. Anyone else sitting in the dark lifting their left leg, with the hand on the right, trying to convince the imaginary doctor that their right leg don't work? A nurse thought I was faking that I could not swallow when I woke up from jaw surgery. When I came out of the surgery and was panicking, telling them I couldn't swallow my own saliva, the nurse just told me, "Yes, you can. This surgery wouldn't have anything to do with your ability to swallow." I could also barely speak and started crying and pleading with her to believe me. I ended up having cranial nerve damage that paralyzed half of my tongue, trachea, esophagus, and vocal cords. It took 8 months to heal. I drank thickened water, which is as gross as it sounds, for 8 months. Having a healthcare professional not believe you during trauma is absolutely scarring. I was knocked over and dragged half a block by a concrete truck when I was 8 months pregnant. I had a nasty cut on my arm, so I got an arm x-ray. Luckily that wasn't broken. I could kind of walk, but my hips hurt. I keep telling them, but they just gave them a simple squeeze and thought it was fine since my response was "ouch, that hurts," instead of screaming in pain. I got a scan and they checked the baby's heart rate and all looked fine, but instead of keeping me in for observation they sent me home with Tylenol. Turned out I was in shock, surprise, and the adrenaline dulled my pain reactions or something. Also turned out I had a fractured pelvis, 3 broken ribs, and massive internal bleeding that they would have seen after a few hours because of the bruising and my blood pressure. Lost consciousness at home trying to go to the bathroom. Called the ambulance, but it was too late. My baby had died and I almost died, and then almost had to have my arm amputated since the muscle had been torn from the bone. Had they have kept me in for observation they would have seen stats plummet. Had a C-section and things would likely have been okay. So if this can happen after a major obvious incident, then I shudder at all the things that are missed. This is horrible. I'm so sorry this happened to you. Holy it, that's a malpractice suit. Please tell me you contacted a lawyer. I had a similar experience. A nurse who was supposed to be numbing my nasal cavity to prepare for a camera to go in didn't know what she was doing and sprayed the stuff straight through and down the back of my throat. My whole throat was numb. I couldn't swallow, could barely talk. And when the doctor came in, I was leaning forward, gagging, drooling all over the floor. She apparently thought I was faking. No idea why anybody would fake this, because she proceeded to try to make small talk with me. "What do you do for a living? Got any pets?" When I motioned for her to give me a pen and paper so I could answer her questions, she sheepishly apologized and explained that she was just trying to distract me. "You can be faking good too. Had a tooth kicked out, mouth filled with blood and swelling. I'd stuck a tissue in to try to stop the blood. I've presented to the triage at the dental hospital. I'm dribbling blood as I talk. She asks me if it hurts and I said a little bit. She looked at me dead in the eye and said one of the many things we triage on is pain. Quotation mark. Gotcha. Good nurse. Hurts like a motherfucker. I've literally been kicked in the face. Thanks for that. Notes taken. Was patched up and out of there within an hour. I hate this, because I'm pretty injury prone, but also don't really exhibit pain that much as I've gotten older. Last time I broke my foot. It's happened a few times. I also didn't have insurance. It was one of the most painful injuries I'd ever had. Free clinics couldn't give anything more than NSAIDs or Tylenol. Again, I get injured a lot, so I have a pretty good idea of when it's going to take more than an Advil to get me through. I ended up going to an actual urgent care, and had to straight up tell them that no, I didn't need an x-ray. Already had one that they were welcome to look at, but I straight up came to them, because the pain was too much to bear and I needed real painkillers. Problem is, I don't really outwardly exhibit my pain, especially not for something like a broken bone, so I wasn't screaming or writhing in pain, or even grimacing too much. I also make a lot of jokes when I'm hurt, because I feel weird about people being overly worried about me. I don't know, it's a thing. She ended up giving me 3 Vicodin, which, fine, I made them last for the week, at which point the pain was starting to subside. But she also hated me for it. Had a friend like that with pain in high school metal shop. The guy literally snapped his thumb in half in the metal lathe and just looked annoyed. From the nail bed forward was hanging by a tiny flap of skin and the guy looked like he dropped his freaking sandwich. You've never seen me when I've dropped my sandwich. Clearly. Nurse here. I had a teenager overdose on Zoloft and start having strange seizure-like episodes. What made them particularly strange is that they all followed a predictable pattern of onset. First, he would lower the bed. Next, he would turn the TV volume down. And finally, he would check to see if I was nearby. There was pretty severe thrashing about without any abnormalities in breathing, heart rate, pupils, and he was still able to communicate with me throughout the entire episode. Unsurprisingly, EEG also failed to show any abnormalities. Neurologist here. While I hesitate to say this patient isn't malingering, I believe that it's important to note that psychogenic non-epileptic seizures are rarely caused by faking. They are generally a manifestation of overwhelming anxiety, and should be treated as such. Mental illness is just as real as physical illness. In my younger days I was on 100 milligrams of Zoloft a day. One day I felt particularly bad. Took a full month's dosage in one hit. Definitely do not recommend. 8 hours later I was in the emergency room. They had to give me an injection as my legs had locked up in the elevated position. They couldn't push them down. Next came the hallucinations. I created a week of events even though only a few hours had passed. To the point I followed a doctor around asking if my brain scan had come in yet, because I thought they wanted to do a brain transplant. I also suffered auditory and visual hallucinations. Eventually I was discharged, but not before fronting a suicide review who asked why I was drinking so much with my antidepressants. Apparently to stop the voices wasn't as funny as I thought. Felt majorly freaked up for a month afterwards. Not a doctor, but a therapist. For some reason adolescents like faking did, formerly multiple personality disorder. It's a pretty rare and debated diagnosis in our field. I've seen people fake it by mimicking how it's portrayed in movies and on TV. Red flags are them telling you, I have multiple personality disorder and, of course, not meeting the actual diagnostic criteria. Some people feel like the common diagnoses aren't big or special enough to accurately represent their struggles, so they cosplay something worse. Whatever you're working through is a big deal to us. If you feel like you have to fake or exaggerate your symptoms for your therapist, consider finding a different therapist. Psych nurse here. I've had plenty of adults fake it too. I'll never forget the guy who actually told the NP I shouldn't have been charged with that. It was one of my alters in regards to his arm drop recharge. I cannot stand this trend of faking did. I'm 18, so around that demographic myself, and it's especially prevalent in certain social media circles. The worst is when someone will list the names, ages, and personalities of all their alters in their bio. Guaranteed there's like a dozen of them, and write from the perspective of each of them. I mean, seriously, put some effort into faking it realistically, not to mention it's something you literally cannot self-diagnose. It is not possible. Oh dear, these kids will cringe so hard 10 years from now. I wonder where this trend started. Was there an episode of Grey's Anatomy that featured it or something? I think they think it will make them seem edgy and cool and interesting. It's no different than kids pretending they have health problems. Thanks for watching. If you enjoyed the video, please smash the like button and leave a comment which story you liked the most. Subscribe and hit the bell notification for updates on our latest videos. And don't forget to check the links in the description box for more awesome content.